Good afternoon, everyone. We are here to present our work on virtual pain management program for arthritic patients awaiting surgery. The background comes from the fact that because of the present COVID crisis, there's a huge backlog of patients waiting for hip and knee replacements. Predominantly, these are elderly patients with multiple comorbidities, and we would expect these comorbidities to worsen or at least be a little complicated when they come up to the point of surgery. When it comes to the delivery of services, we need good quality of pain control, physiotherapy services, psychotherapy, and healthy lifestyle management, including body weight. And with our previous experience with digital platforms, we plan to do it in a digital way. The aim of the study was to address the issue of pain management on a digital platform in the cohort of patients waiting for hip and knee replacements. And at the same time, we would like to see how effective is the modalities of pain management, including yoga, physio, biofeedback, and fitness exercise therapy. All ambulatory patients who are considered as long waiters at the P4 stage will be considered for hip and knee replacements. The essential thing what we are looking for is the patients have to be either freely mobile or have to be dependent minimally on walking aids. All those patients who are considered urgent, those with infection, and those with systemic diseases, including rheumatoid arthritis and SLE, and those with malignancies are automatically excluded. The digital application we plan to use is something called an Apparito, which is a North Wales-based company, and we gather that this company has done some work on digital applications in other medical fields, including pediatrics. And we feel that this technology is easily sustainable and transferable to the patients. The methodology would be to identify the patients, the disease, the comorbidities, the social and medical issues, and address any gaps in the pathway, which we expect there is going to be some hindrances. And we are also trying to identify the best way to capture the data and analyze them later and assess the efficacy of the program finally. This slide highlights the workflow pattern. Basically, the first two steps will be on designing and strategizing the whole pathway. And once it becomes operational, we go right up to the dashboard analytics, and then we retrieve the data and analyze the efficacy of the program. This is how a screenshot of the application looks on a different platform. Of course, this is applicable to a pediatric thing, but we need to develop an app which is suitable for orthopedics. When it comes to measuring success, we collect the data and analyze the cost involved in the management of services and compare with the conventional approach. We plan to do regular audits with the patient feedback and outcome analysis. We believe the potential advantages of this pathway to be an alternate method of delivering community physiotherapy and rehabilitation. Now, rehabilitation has gained lots of importance in the present scenario, particularly those patients waiting for a knee replacement. Also, it is a way of managing pain and general health in the community. It is cost effective from our previous studies, as we know, and this potentially will reduce the stress on secondary and tertiary services. In future, we would like to link up with other societies managing arthritis, including Arthritic Society, Arthritis Action versus Arthritis, and sit with them and develop a pathway for pain management and physiotherapy services. And we also believe that this will be a good platform to initiate rehabilitation for those arthritic patients. In the end, we would like to acknowledge our patients and the NHS staff for having tirelessly worked for the NHS during the pandemic crisis. We are just coming out of it now. Of course, great thanks to Bevan Commission for their help, encouragement, and support throughout the process towards prudent ideas and concepts in bringing efficiency into the system. We are ever grateful to the Department of Research and Innovation at Betsy Cadwaladr University Health Board.